Thank you very much, Stephanie. I hope you can all hear me.
Yep.
Okay, great. Good afternoon, good morning, everybody. My name is Natasha Mazonde, and I'm a research assistant at the SAMRC, Wits Center for Health Economics and Decision Science, which is priceless, housed in the Wits School of Public Health. And I'm going to present to you today on a study that we titled The Media Coverage of the Health Promotion Levy in South Africa. Okay, I'm just trying to move my slide. Okay, sorry about that. So in terms of context, the Health Promotion Levy, as it is referred to in South Africa, is actually the tax on sweetened beverages, which is also called the sugar tax. But in the context of South Africa, it's referred to as the Health Promotion Levy, which is the HPL. It was first announced in 2016, but only implemented in South Africa in April 2018. Against the background of high obesity rates, which were linked to SSB consumption. And as a result, the HPL was introduced as a health policy intervention measure to address the growing obesity rate burden in South Africa. And in terms of why we chose a media analysis, there's evidence growing that news media framing of health policy issues tends to shed light on the political processes that are actually involved in introducing health policies. And also through media debates, we found that there's a potential to influence public perceptions on health policy issues. And lastly, again, through a media analysis, we found that through a media analysis, we're able to gain insight on how policy advocates, and in some cases, policy opponents, actually shape their debates within the media landscape. So our study was guided by the central research question, which we wanted to find out how was the introduction of the health promotion levy deliberated in the South African online media. And we also wanted to find out how this coverage changed over time. And the main study aim that guided our research was to understand the framing of the health promotion levy in the South African online media from the period January 2015. This was a year just before the levy was first announced, to April 2019, which was again a year after the levy was implemented. And our study was informed by 3 study objectives. The first one being we wanted to identify who were the major voices that shaped HPL coverage within the media space. And secondly, we also wanted to understand the kinds of arguments or themes that emerged within the media space. And lastly, we also wanted to understand the general sentiment that was within the media towards the HPL. Moving on to previous research, or what was known or what we found within the literature. We found an increase in media attention of obesity or NCD health policies. This was both at a global context, within a global context, and also within the African setting. And secondly, and more recently, actually, we also noted that policymakers in the context of low and middle income countries are beginning to consider SSB taxes as a measure to promote public health and also to improve food environments. And lastly, we found within the news media landscape that there were key frames that emerged as dominant. And the first one was around whether or not the tax was a cost-effective health policy intervention to address obesity. And secondly, whether or not the tax was an appropriate intervention to address obesity. And thirdly, we also picked up a frame around the economic and social benefits of introducing the tax. And lastly, arguments around the potential impact that the tax would have. In terms of methods, we conducted a descriptive observational study of online news articles, where our setting was all online, all the South African online news platforms. And our population was all news articles, online news articles that actually mentioned the SSBs or sugary drinks, together with the health promotion levy or the SSB tax, or as well the sugar tax. And these had to be published between the 1st of January 2015 to the 30th of April 2019. And we collected our data through Meltwater, which is a global media monitoring company, which provides comprehensive media monitoring and analysis across online news. In terms of analysis of our data, we conducted a mixed methods study where we conducted qualitative studies analysis to understand frequencies in terms of coverage of the HPL within the media, and also to get an understanding of the number of articles that were actually published within that time frame. We also conducted a qualitative discourse analysis where we wanted to get an in-depth understanding into the frames and the narratives that were being pushed within the media space around the HPL. And our analysis was actually conducted against the backdrop of the 3 phases in the HPL policymaking process. Phase 1 was when the policy was actually first announced and introduced. Phase 2 was the legislative process, where we had a series of parliamentary submissions in response to the proposal for the HPL. And the 3rd phase covered, this is post the implementation. So the 3rd phase was post the implementation, where a lot of the media discourse covered impact of the tax. And in terms of our discourse analysis, we basically sampled a small portion of the data, and we used a criteria of diversity of publication, voice, and media reach. And in terms of the discourse analysis features that we selected, out of the 12, we found 12 discourse analysis features. But for the purposes of this study, we picked on 4, which we thought addressed our study aim together with the objectives of the study. And these were the source, the actor, argumentation, as well as the framing. And our analysis was guided by the conceptual framework of media analysis, where we defined framing, where we got a definition of framing as involving, emphasizing some aspects of an issue, as well as excluding other aspects. In this context, we found selection, emphasis, elaboration, and exclusion as some of the features within the media framing framework that we employed to analyze our data. Moving on to key findings, we found out that the South African media landscape was highly reactive to the HPL introduction. There was diverse voices and coverage of the HPL issue within that time frame. And we noted in terms of coverage that it shifted over the course of the policy adoption process. This is across the 3 phases that I've initially mentioned. And with regards to news sources, we noted that the framing of the HPL within the media space actually influenced our classification of the sources. So we eventually landed with 3 I'd say general categories of publications: business publications, health, and general publications. And with regards to the actors, we found a diversity of voices that actually spoke and debated about the health promotion levy. First one being industry actors, and these were mainly the beverage and the sugar industries. Government policy makers, health professionals, this is a broader category, but this involved health researchers, health professionals, and advocacy groups, which were mainly health advocacy groups. And then lastly, in terms of sentiment, we found a mix in terms of sentiments within the media landscape. as you can see, between that time frame from January 2015 to April 2019, 45% of the sentiment was positive in support of the health promotion levy, 40% was in opposition of the health promotion levy, and a 15% was neutral. Some of the key arguments that emerged within that media analysis were around appropriateness of the health promotion levy. This we picked up in the first phase at the introduction, where issues around whether or not the health promotion levy would be an appropriate measure to introduce in response to the increasing health obesity burden in the country. And another argument that we also picked up that was also dominant within the second phase of the process was around evidence on the effectiveness of the health promotion levy or lack thereof. And some of the emerging evidence noted to the issue around the cost effectiveness of the health promotion levy. And lastly, we picked up another dominant theme around the unintended impacts and the benefits of introducing the health promotion levy. This was dominant in the third phase, although we did pick it up in, I would say, across the three phases, where issues around jobs within the economic sectors of the beverage industries and the sugar industries would be affected by the tax. And again, another issue around whether or not the tax would actually impact or influence consumption of sugary and sweetened beverages. In terms of significance and the policy implications, firstly, we do note that this study highlights complexities around news media framing of health policy issues. And we also do note that through this analysis, we are able to gain more insight around the political context that is key in shaping and informing processes around developing health policies. And lastly, we feel that through this analysis, policymakers can leverage media debates to maximize acceptability of health policy issues. We also came across, we had limitations, we also had strength throughout the process. And one of the strengths around our study was we engaged very robust research methods, which provided an in-depth insight into the media coverage. Definitely through the discourse analysis, we were able to zone into what each of these online news articles actually tried to communicate. And we conducted our analysis against the backdrop of the three phases in the policymaking process. And through that, we were able to observe shifts in the media discourse over that time frame. And lastly, we did analyze, as a limitation of the study, we did analyze only South African online news articles. We excluded other media platforms. Particularly in mind right now, I've got social media, which could have provided deeper or further insights in terms of the debates around the health promotion levy in the context of South Africa. And in conclusion, we note that the media landscape in South Africa did reflect diverse stakeholders' views on the HPL. And we also note through media framing of the HPL, there were shifts in terms of the discourse in relation to key milestones in the policy development process. And we note lastly that South Africa's experience in adopting the HPL mirrors similar experiences in the case of Mexico, the UK, and the USA in terms of the diverse and the complexities just around opposition of the text, the debates that centered the framing, the introduction, as well as the implementation of the text. So with that, I just want to say thank you very much for listening. I'd like to also take this opportunity to thank the funders of the study, the International Development Research Center, Canada, as well as the SAMRC. Thank you very much.